though?
No, bring it up. Yeah, bring it up.
So my back has been, I've been dealing with pain, and I know you hear it often, man, but I've been dealing with pain since I can remember, right? I've been adjusting, I've been kind of compensating certain directions, I've been self-adjusting 100%. I'm not gonna sugarcoat it, but it's just a lot of pressure now. What's started happening, which is now I'm getting sharp pains from like towards like the back buttock area, I guess you can say, whatever. But when I walk, it's just hurting, it shoots down, very painful. Up and down hurts a lot, migraines.
Okay.
So definitely that lower back area.
How many migraines do you have a week or a month?
About three or four.
A month?
A month, so I'm gonna say a week, so.
I mean, you said as long as you can remember you've had pain, so like, do you know the details of your birth? You know, if you were born natural or cesarean?
No.
Okay.
It was natural.
It was natural?
Yeah.
Jeez, that's cool. Okay, any complications?
No.
No?
Oh, you know what? They did have to use the forceps.
Okay, forceps, baby.
Yeah.
Okay, very good. Alright, that may be significant for the neck, we'll see. It's not a direct indication. Sometimes midwives know how to use forceps, and like if they can use them in the proper way, then they're super
It was
effective.
forceps and the suction.
Intersection?
Yeah.
This is all news to me, Doc.
Okay. Alright, anything else that you want to tell me? Anything else that you can think of that might be important or valuable?
I'm ready.
Alright, do me a favor, go ahead and stand up right there. And then keep facing over here. Oh yeah, you're stiff, sir. Not too bad. High right ear too. Just sneak down into here. Yeah, a little bit higher on this side on the right. Right ear is higher too, so a little bit left lateral flexion. So your head is just tilted like this. It's a tiny bit, but it's all very mild. Now coming down to the hips, let's see. High left hip. So you've compensated a bit here with your high right shoulder, you know what I mean? Like this is like this, and this hip is diving down that way. And the right leg is where the sciatica goes down.
Yep, and the left.
Oh, both. You said both sides when you were walking.
Right.
I for it to be sciatica, both sides when walking. Maybe it's just your sacrum. Let's see what your pelvis is. All right. Okay. Well, this is actually pretty even now. That's good. That means our pelvis isn't under a whole lot of stress. If the glutes are pretty symmetrical. And
You hear that? I have amazing glutes.
He does. He's got great glutes. He's fantastic.
I know she was wondering. See that
That one right there, right?
hurts.
And this is glute major, but this is right on top of where the coccyx comes out, so we're gonna have to do some Logan basic there. Yep, your feet stay in that external rotated position. So we might have a double IN pelvis, that's good. Yeah, the knees come off to the side. The hip extensors here. These are just sore from you being in pain, and these muscles are clamping down on the pelvis to prevent movement, to keep it from pinching that nerve, which it sounds like. All right, now you have a little bit of this hunch right here. You know, you're definitely sitting down a lot. Did you lose some weight too?
Sure.
Yeah. Were you heavier at one point?
Yes, definitely have it at one point.
Yeah.
Oh, like in my life, yes. I do mean like recently, but yes, I was definitely a lot bigger.
Mm. How big were you?
Probably about 250, 260.
Damn. Yeah. You lost almost 100 pounds probably. 90, 80?
Yeah, about. I'm like 200 now.
Okay. Good for you.
Thank you.
Tender right here?
Yeah, I feel that.
Right SI joint, left SI joint tender right here?
That's it.
That's more over there, right?
Yep.
Alright, let's come up to the sacrum, lumbosacral joint and push it left side.
Oh.
Yep. Right side too or no?
Not as bad.
Okay, let's come up to L5.
Yep.
Good. Yeah?
Mm-hmm.
Let's see how high it goes. Yep. One more.
Yep.
Good, one more.
Yes.
It's starting to fade though, right? It's almost the entire lumbar spine, so you've got a lot of muscular compensation happening in your spine, but that's because your spine is where the pressure is. See, that's it. It's where the pressure is, the strain. Probably the ligaments around the spine, also a little bit of disc stuff. Sounds like we have some tension in the spinal cord. Not necessarily a pinched nerve, but a stretched nerve in the center, and that's why you're feeling it in both sides.
Would it cause pain in the legs too?
Yeah, absolutely. Yep. All right. Okay. So, all right, that's good. It's actually pretty straightforward for how severe it is. It's and you're managing it well. You know, you're tolerating it well too. We've got a little bit of edema right here, but this is all coming from the spine. The sacrum needs to be adjusted.
Which I'm gonna snitch myself out, but I lay down on my back and then put one of my legs towards the other side and try to like adjust. I'm probably making it worse. But
How does it go?
it gives that relief because I guess maybe I'm feeling pain somewhere else or doing something somewhere else.
Yeah,
but
yeah.
It's never permanent.
That's okay. It'll feel much different when I do it.
Right. Yep. Feel that.
All right, so this is our primary lumbar segment right here. This is advanced muscle palpation. We're probably at L3 or L4 for the segmental.
See, like that's making like this throb.
Okay.
I feel a throb in my legs, like a pulse.
Okay, very good. Okay, thanks for the feedback. It's helpful. Good. Let's see what's happening up here. Good. I'm gonna bring this down. Good. Back up. Good. Where do you feel it? Where my fingers are? A little bit higher.
I actually feel it down my back.
Down here?
Yes.
Okay. Yeah, we definitely have some cord tension. Spinal cord is in tension. That's how I feel sometimes too, bro. Just jump into the spine stuff. Alright, I'm gonna push here. Pain?
Yep.
Yeah. How about this side, right side?
Yep.
Alright, let's do this. Lift your right leg up in the air. Good. Down. Left leg. Down. Which one was harder?
Can I do it again?
Yeah.
The right.
Right side, possible sacrum on the right. That suggests the sacrum on the right, which is where the edema is as well. And then the tenderness on right versus left right here, which one's more?
Tenderness.
Or same?
I feel the right.
What about down here?
The right.
Okay, we got right SI stuff. Now let's check which lumbar. L5. Ready? 1, 2,
Oh! Yep.
3. L4.
The other one.
Alright, L4, right SI. Let's figure out which way we're going to adjust this L4. Let's bring this like this. I'm going to get you on blocks in just a second. As soon as I analyze this, the blocks will help decrease some retention. Alright, let's see, right or left? Which one more? Or same?
Same.
What about this one right here, right or left?
Right.
This right hip, right one underneath here, good. Down. Good. Get it leveling up just a little bit, good down. Okay, any increase in pain when I put you on the blocks? Alright, we're gonna start just trying to stimulate, we're gonna start stimulating the sacrum here. We want your body to like sink into this position that the blocks are putting it in. And so we'll just stimulate the big joints that have lots of proprioception in them, increase some muscle memory, decrease some tension. It's called diversified. Diversified is when you use multiple different techniques.
Are you straining my back hairs?
How does it feel like that?
No, I'm just kidding.
Oh, straightening?
Yeah.
I thought you said straightening. Now we're just trying to get some of this glute to relax here. Good. Now, all right, first let's start off here. Let's see how the glute, you got underwear on, right? Yeah, let's do this. We're gonna start off and do some Logan basic here. All right, let's find it. Let's see, 1, 2, 3, 4. Let's see, that one? Okay, let's go this side. 1, 2, 3, 4. It's 3 both sides. Which side more? Left, right, left, right, left. Okay. Okay. This is gonna be L3. which we've identified L4, L3, and C3, T12. Let's see. God, how bad. All right, so we're just going to take this tension out here. Good. This goes like this. This one goes in this direction. Good. 1, 2, 3. 1, 2, 3. 1. Almost. That's pretty good. Let's see. How's that feel? Is that better? Same.
Yeah, no, it feels better.
That's good. Good. Okay, so that's the Logan basic technique. Let's try the chop fibers. This is not SOT technique. What's your name?
Zion.
Zion?
Zion.
Zion. Cool. Cool name. Do you know what it means?
Okay.
That's a good thing to look up later. You can ask Siri later.
I kept on looking at dictionary in school.
That's tender, right?
Uh-huh.
Z-I-A-N?
Z-I-O.
Oh, Z-I-O-N? Zion. But you say Zion.
Mm-hmm.
Yeah. That was the name of my old house that I used to live in. It was named Zion.
That's cool.
Zion is like a promised land kind of thing. It's like a safe place. An eventuality. High ground. It's good stuff. What are you into? What do you like to do? Do you play sports?
Mm-hmm.
Have you read any good books lately?
Yes.
Tell me, what's your favorite book right now?
It's the one that Poppy gave.
Oh, okay.
What's the name of it?
Honest June.
Honest Jude?
June.
June. I think I might have read that one, actually. Cool. Is June the main character?
Yes.
Cool. And Poppy, that's your grandfather? He gave you the book?
No, that's it.
Oh, this is your dad? Oh, my God. You're so lucky. You got that. I wanted it. I was like, have the kids call me Poppy. Come on. And God turned into Daddy. All right, how's this? Is this still tender? Yeah, a little bit. Yeah. Hold on, we still got more work here. Okay, here it is right here. Good, we just get it. Yep, there it is. It's already leaving. Good, we're just gonna pull this apart. Good. Oh yeah, it's still there. Yep. Get it out, yeah. Do you have pets at home?
Yes.
You guys seem like you have a dog.
I do.
You dog family? How many? 1 or 2?
1.
One. And I got 2 birds.
2 birds? Oh my God, what kind of birds do you have?
I don't know, but
Are they colorful?
Hmm?
Are they colorful?
yes.
Do they talk?
Not yet.
I'm teaching them?
Mm-hmm.
Cool. See who's gonna talk first. The birds are your brother. But he talks to them.
A little.
A little better?
Mm-hmm.
Still a little bit. That's because we have to adjust this T3 right here. T2. There, that guy. All right, let's work out some spine stuff now. Good. Do you take the dog out? No? We can start helping your parents take the dog out sometimes?
Yes.
It's your dog too. You're a good helper though, I can tell. All right, nice and gentle breathing. You've been adjusted before. I'm going to follow the breath out. Let's just feel the spine. That's good. Go and take a deep breath in and out. Good. Shoulders relaxing. Good. Sinking in. Good. A little bit more. Now, we're gonna drop the headpiece down for this guy just a little bit. And out. Good. Shoulders relaxing. Good. Very good. That's it right there. Good. Deep breath in far as you can go. All the way. Did you feel it down low? Okay. Okay, nice, gentle. What are you doing?
Cracking my arm.
Oh, you're cracking your elbow? In the middle? Okay. You gotta go out if you want to crack it. This crack's there, not here.
Like when I do this.
Yeah.
Crack it.
Oh, okay. Is it cracking? That's okay, that's normal. It's fine. Is there pain right now in the low back where I'm pushing? Sacrum first. So we're gonna lay on your left side. Good breathing.
Leave my arm down.
No, bring it up. Yeah, bring it up. Okay, sir. We're not gonna rotate you too. We're just gonna stretch your shoulders up in this direction. How do you feel when I do this? Is that okay? Okay, we're gonna get your hip adjusted here. There's sacrum. Good, let's give it a try. Go and take a deep breath in. And out. Good. It's perfect. Right there. Shoulders coming up. Good. A little bit more. A little bit more. Good. Good. Oh, beautiful. And then your back. Right through the entire SI joint. It's perfect. Now, that's the primary long-term cause of your issue right there, that right SI joint, okay? But this next one, the lumbar, is what's making it hurt now. All right, so let's do that one. And just like this one over here. Okay, not bad. Good. Here. Good. It's not here. Here. Good. Okay, ready? So let's give it a try. Go and take a deep breath in and out. Good. Shoulders just like that. Good. A little bit more. Good. That was really good. Any pain down the leg when I did that? No stretch? Okay. We get some steps. Good.
Sit up.
Yep. All right, let's take a couple steps around. Let me just see. Okay, not bad, but there's more, for sure. You need the ring dinger. What grade are you in?
Third.
Third grade? Oh my god. Did you learn cursive writing this year?
No.
No? Did you already learn that in second grade?
No.
No? Okay. Good. You're a graduate, you're done now, right? Summertime?
Almost.
Mm-hmm.
My last day is Saturday.
Saturday, and then what happened? Did you get your driver's license? Did you get to drive after third grade? I forgot. No? Good, because you're probably going out and partying with your friends all the time, aren't you? No? Mm-hmm. No, you don't seem like it. You seem pretty stable, grounded. Yep. This one goes all the way down, too. When's your birthday? September?
No, May.
Oh, you are a Taurus. May what?
12.
Oh my gosh. Mine's May 16th. I knew you were an earth sign, though. I guess Virgo, but you're a Taurus. Cool.
It's increasing the headache.
You feel more out here?
Mm-hmm.
Both sides equally? Or just the left?
Left.
Okay, good. That's actually, again, more evidence to suggest that it's musculoskeletal in nature. Okay, let's adjust this. So if I'm pushing, it's because it's an Yeah, it's because it's anterior. Okay, so we need to come up on that and then just do this on occiput like this. Okay. Does that increase the headache?
Mm-mm.
Yes? Or no?
Mm-mm.
No, it's
No.
relief?
Mm-hmm.
Okay.
It's so painful, man. I've like manipulated myself to deal with it.
Yeah.
It takes away from like happiness and just wake up angry.
Mm-hmm. Yeah, not your fault. It's actually 100%. Like, being in pain takes energy. Your brain has to process it. Your brain is constantly trying to, create balance in the chemical equation, all the dopamine, serotonin, all the endorphins. You know what I mean? Your brain is constantly trying to create more endorphins to decrease the pain sensation subjectively, right? Which makes your gut work harder too, because your gut is where it's all being created.
Right.
So it's 100% okay to be in pain and then to be a little grumpy about it. I'm glad you came. That's why I'm here. Underneath and hold it like this. Bring your head over like this and down. That's good. There should be one here. I can feel it. It's ready to go. Okay, you ready? I'm gonna crack this. It's good. That was really good. It's probably a little strained in there, right? When I did it. Those are some old adhesions. Okay, now I'm going to adjust the same segment, but we're going to push it back over from left to right. Good, we're going to get right on top of it, right there. Let the head and shoulders sink in. Good spirit. So first you're going to let your legs come back this way. Good, good. Yep. Okay, that wasn't too bad. Alright, a little bit of support there on the lumbar on the sit-up. Let's see what happens. You're going to stand up. See if there's a buckle. No, still lumbar muscles haven't activated yet. So we're going to come over on this guy. And we're going to follow this breath out. All you have to do is keep your teeth together. Good. We're going to follow the next breath out. So we're good. And out. Good. Keep breathing. Yeah. Okay, that was pretty good. We're gonna test it out now. Okay, it's better, but it's still not yet there. Let's do this. Let's come out here and walk down the hallway a little bit. Get a good stride going.
My heart is beating so
You're doing
fast.
great. All right, that's one layer. Let's do this.
Yeah, when I put a lot of pressure on this left,
Give it to me. Yeah.
it's like,
You feel it on the left side.
yeah.
Do you feel it down here? Or do you feel it up here?
Up.
Yeah, this is
Yep,
so.
right there, yep.
This is just the muscle not activating yet. So we need to get this muscle activated. That's fine. Let's try this. Let's lay on your belly here. Everything's vibrating all the time. Are you familiar with string theory yet? Do you know what atoms are? No? Do you know what cells are in your body? Yeah, it's kind of like Legos, right? If you put together a big Lego, it's made up of all different little blocks. That's like cells, okay? But cells are made up of smaller blocks too. And those blocks are made up of smaller blocks. So the tiniest of the tiny is called the atom. A-T-O-M, atom. And atoms have even smaller blocks inside of them, and there's even smaller blocks inside of them. Yeah. And what scientists think is that the smallest of the smallest blocks aren't even really blocks. Okay, at that point, it's actually just a string, and it's vibrating. It's either vibrating up and down, or it's vibrating left and right, or sideways and diagonal. And everything in the universe that you see is made up of those vibrations. Kind of like, you ever played the guitar? Yeah, guitar, all stringed instruments, strings, guitars, pianos, all that sound is just coming from vibration. Pretty cool. your digestion?
Mm-hmm.
You stressed?
A little bit.
Is it tough going to the bathroom, or is it the other way?
Lately, it's been a little tough.
Okay. And yeah, I think the next
Because the lower back could be digestive related too, right?
Yeah, I mean, it's part of it for sure. It could go either direction. You know what I mean? Your stress in your digestive system could be causing your low back to be strained, or straining your low back can cause, usually it's more that. Usually it's more straining your low back. It makes it harder for you to digest. But, you know, if anything is really the chicken or the egg, either way. But if anything comes first, it's the mental state. You know, it's the science called psychoneuroimmunology. It means how your mind affects your brain, which affects your immune system and every other system in the body too. But psychoneuroimmunology, it all starts with like how you deal with stress, perceived stress. Stress is inevitable. That's all there is. That's all there is. It's either good stress, bad stress. It's just a matter of how you handle it, how you perceive it, how you process it. And it's okay for it to add up sometimes. You know. Let's roll back to this side again, Smear. Yep.
To
Yeah,
land
face
my
me.
right.
Yep. And then sit up. Okay, that was good. Okay, let's do that. We're going to stand up. We're getting there. Then, okay, we'll follow the next breath out.
That one was very different.
Mm-hmm. How'd you feel the first time? Where did you feel it at?
So the first time it was a lot more above
Okay.
than below. I did feel it below,
Okay.
but I didn't feel the decompression like I just felt right now. I
Uh-huh.
felt like the first time, if I'm being blunt, like I got a neck adjustment,
Okay, good.
right, over the full.
Mm-hmm.
This time when I felt like the pull, I feel air going through my body now.
Oh, okay.
If that makes any sense. Like I just feel.
Yes, like the Kundalini.
Mhm.
Chi.
And like before, when I was laying like this and I stretched my back upward,
Mm-hmm.
like when I'm doing this, like it was pain. I couldn't, but I was forcing myself to do it. Now, it feels more like it's sore, actually, than painful.
Good.
If that makes any sense.
Yeah, the soreness is the muscle turning back on.
Right. Well, sore I respect because I know sore means healing.
Yes. The first thing that's great is that when you sit up, you're not immediately bracing. Okay, like the first time you sat up on the table. Good. Absolutely no buckling there at all. Good.
So much was done, right?
Yep. Mm-hmm.
It's still like when I step.
Mm-hmm. Okay, good. I mean, I think that there's one more in there. There really is one more pull.
What?
Yeah.
You need to start doing that.
No.
But I'm a vegan.
You're a vegan?
Oh yeah, we do vegan cheese.
Yeah, I hear ya. Do you know what blood type you are, sir?
No.
I mean, that's valuable too. I mean, I find that. What's that?
Do you want me to ask you about you or not?
Not for right now, but thank you. I do appreciate the help. You're a great helper. You're awesome. Okay. Yeah, that could be helpful too. You know, I find that people who are type O, and my friend was vegan for like 10 years, and like he's O positive, man, and just had crazy symptoms coming down. Like couldn't narrow it down to one thing, and I'm just like, man, you haven't eaten meat in a long time. We might need to do some fish oils. You know what I mean? Get some omega-3s in here. You just gotta be careful. B12, omega-3s.
You
You need
never
to,
turned into a
You need
vegetarian.
to do the teaching thing, teach this approach, and it's so personal, it's so different, and this is far from a normal chiropractic visit.
Yes.
This should be the normalcy.
You're right. It should be absolutely. Yep. We still have one more. Yep.
Oh man, not again.
Yep, one more. It's all good. Good. Okay. Deep breath in here. Good. Sinking in. Shoulders and hips, everything's sinking into the table. We'll follow another breath out. Just let everything sink in one more time. Just slowly let it release and just let it all go. Good. That's very good. There we go. That was it. That was the one. Yeah. Good.
Anybody want water?
What's that?
Anybody want water?
Thank you. That's very nice of you. We're good for now. Dad's got water right there.
So all my breath out.
Mm-hmm. Well, it's looking pretty good.
Feels better.
Push. Okay, let's get relaxed. Did you feel that down there?
Yeah.
Okay, let's do this here. I'm gonna bring this up. Okay. Good, okay, relax. Let's try this side, see if it does the same thing. This side, yeah. Okay, push here gently. Feel it?
Mm-hmm.
Good, then relax, it's okay. Good, let go. Alright, push this arm out again. Alright, push up against my hand lightly. Good, then relax. Good posture adjustment there. Feel strong. Okay, ready? Does this feel like this? 1, 2, 1, 2. Are they the same or does one feel more tender?
Feels the same.
Okay, good. How about these here? Do these feel the same?
Mm-hmm.
Yeah, that's really good. 1, 2. They feel the same? Left, right?
Mm-hmm.
Okay, good symmetry in the cranials. That's favorable towards a positive result for the headaches too. Cranials get stuck, they take a longer time to fix. But if it's really just coming from this occiput in the neck, then you should get a good relief. I mean, you should know pretty quickly you have 3 migraines a week. So you'll know in a week, based on how many migraines you had, how effective we were. Yeah, this is the only one right here. This just needs a tap. Okay, we're just gonna breathe through this, gonna take a deep breath.
so patient on this. We're gonna eat in a little bit, okay?
Okay.
You're doing fantastic.
I think I could wait for a few minutes or hours. Now it's hours.
Good. We're gonna bring this back just a little bit. Okay, everything that I possibly could have cracked today. And then some. So we've done the physical work here. Your body definitely has some like internal strain at the level of the spinal cord, or it had at multiple levels. And so we reduced that obviously, okay, but over the next couple of hours that reduction will continue. So let's just let it play. Let the body do what it needs to do. I'm excited for the headaches. And you're gonna have to be careful with your low back for sure. You're gonna have to be delicate. I want you to go home and ice it and keep doing the stretching. The stretching is the medicine. It makes you need me or any other chiropractor or really any doctor, period, much less. That's good. Here, I already hit you with some magnesium, but you're gonna need more of this too. Okay. Alright, so I want you to ice. So when you ice, lay in that position like you were on that table, on your back with your legs up. Let's see what it feels like. Yeah. To come back next Tuesday means it doesn't get any better at all, or it gets worse. Okay. If that's the case, then I adjust you again next Tuesday.
Gotcha. Okay.
If it's feeling good and you're getting a little bit better every day, that's the way that should be. Then when you hit the plateau of like it's been the same for a couple days, that plateau is when you come. That might be anywhere from 2 to 4 weeks. We're looking at complete resolution. Like I'm not really thinking about it too much. I can do all range of motion without pain, probably in that 2 to 4 week time period. But if you're not there at 4 weeks, then I'll adjust you at 4 weeks.
Seriously, man.
Yep. I work
You're
hard for
awesome,
my
bro.
money too.
No,
So
you're
it's
awesome,
good
bro.
to
I'm
share.
serious, man.
Yeah,
Bro.
that's
Seriously,
cool.
man.
That's cool.
Nah, you're awesome, bro. I'm serious, man.
You're awesome.